Welcome to First Aid review of Embryology, brought to you by Falcon. If you feel as though that further information is required, please refer to Falcon Online. Embryology. Zygote. This cell formed by the union of an ovum and a sperm represents the beginning of a human being. The humor and illness are already on the sperm and are transmitted to the embryo. Is life worth living? This is a question for an embryo, not for a man. Embryology is traditionally one of the higher yield areas with anatomy. This topic can be crammed closer to the exam date. Many questions focus on underlying mechanisms of congenital malformations. Example, failure of fusion of the maxillary and medial nasal processes leading to cleft lip. Important genes of embryogenesis. Sonic hedgehog gene, produced at base of limbs and zones of polarizing activity, involved in patterning along anterior-posterior axis. WNT7 gene, produced at apical ectoderm ridge, thickened ectoderm at distal end of each developing limb, necessary for proper organization along dorsal ventral axis. FGF gene, produced at apical ectodermal ridge, stimulates mitosis of underlying mesoderm, providing for lengthening of limbs. Homeobox gene, involved in segmental organization of embryo in a cranial-caudal direction. Now our discussion brings us to fetal landmarks. Day 0. Fertilization by sperm forming zygote, initiating embryogenesis. Please refer to the illustration as we go through this. Within week 1, HCG, human chorionic gonadotropin, secretion begins after implantation of blastocyst in the endometrium of the uterus. Within week 2 has bilaminar disc development, epiblast, hypoblast. Week 3, gastrulation. Primitive streak, notochord, and neural plate begin to form. Weeks 3 to 8, known as the embryonic period. Neural tube formed by neuroectoderm and closes by week 4. Also, organogenesis begins, extremely susceptible to teratogens. So look for drugs that might affect the child at this point. Week 4, think of 4 heart chambers. Heart begins to beat. Upper and lower limb buds begin to form, 4 limbs. Week 8, known as the fetal period. Fetal movement, fetus looks like a baby. Week 10, genitalia have male-female characteristics. Alar plate, known as the dorsal. Basal plate, known as the ventral. Think of your spinal cord. Impulses will come in the dorsal area. The alar plate, sensory information. Basal plate, ventral, responsible for motor innervation. So therefore, same orientation as spinal cord. And if you refer to the illustration, you'll notice after ovulation, fertilization, day 0, zygote, day 2, day 3, gastrulation, formation of morula, day 5, blastocyst, implantation on day 6, day 18 through 21, neural plate, notochord, neural crest migration. Neural crest cells form an entire tube as maturation continues. Neural development. Notochord induces overlying ectoderm to differentiate into neuroectoderm and form the neural plate. You may want to refer to the previous slide about this. The neural plate gives rise to the neural tube and neural crest cells. Notochord becomes nucleus pulposus of the intervertebral disc in adults. Rules of early development. Rule of 2s for second week. 2 germ layers, bilaminar disc. What are they? Epiblast, hypoblast. 2 cavities, amniotic cavity and the yolk sac. 2 components to placenta, the cytotrophoblast and the syncytiotrophoblast. Then we have rule of threes for third week. 3 germ layers, gastrulation process, ectoderm, mesoderm, endoderm. Rule of fours for fourth week, as we had mentioned, 4 heart chambers, 4 limb buds. In the margin, the epiblast, precursor to ectoderm, invaginates to form primitive streak. Cells from the primitive streak give rise to both intra-embryonic mesoderm and part of the endoderm. Embryologic derivatives. Ectoderm. Surface ectoderm. Adenohypophysis from Rathke's pouch. Lens of eyes. Epithelial lining of oral cavity. Sensory organs of ear. Olfactory epithelium. Epidermis. Salivary, sweat, and mammary glands. Neuroectoderm. Brain. Neurohypophysis, CNS neurons, oligodendrocytes, astrocytes, ependymal cells, pineal gland, retina, and spinal cord. Neural crest. ANS, dorsal root ganglion, responsible for sensory information, cranial nerves, celiac ganglion, melanocytes, chromaffin cells of adrenal medulla, parafollicular C cells of thyroid, Schwann cells, pia and arachnoid, bones of the skull, odontoblasts, aorticopulmonary septum. In the margin, craniopharyngioma, benign Rathke's pouch tumor with cholesterol crystals, calcifications. Neuroectoderm, think CNS and brain. Neural crest, think PNS and non-neural structures nearby. Odonto equals teeth, think crest toothpaste. Endoderm. Gut tube epithelium and derivatives. Examples, lungs, liver, pancreas, thymus, parathyroid, thyroid, follicular cells. Mesoderm. Muscle, bone, connective tissue, surface lining of body cavities, such as peritoneum, spleen, derived from foregut mesentery, cardiovascular structures, lymphatics, blood, bladder, urethra, vagina, eustachian tube, kidneys, adrenal cortex. Once again, I repeat, adrenal cortex versus the medulla, which was neural crest. Skin dermis, testis, ovaries. Notochord induces ectoderm to form neuroectoderm, neural plate. Its postnatal derivative is the nucleus pulposus of the intervertebral disc. In the margin, mesodermal defects. Vacral. V. Vertebral defects. A. Anal atresia. C. Cardiac defects. T. Tracheoesophageal fistula. R. Renal defects. L. Limb defects. Bone and muscle. Types of error in organ morphogenesis. Malformation. Intrinsic disruption occurs during the embryonic period, which is what? Weeks 3 to 8. After 8, known as the fetal period. Deformation. Extrinsic disruption occurs after the embryonic period. Agenesis. Absent organ due to absent primordial tissue. Hypoplasia. Incomplete organ development. Primordial tissue present. Distinguish this from agenesis. Aplasia. Absent organ despite present primordial tissue. Now our discussion moves to teratogens. Most susceptible in 3rd to 8th week, which is embryonic period. Organogenesis is taking place of pregnancy. Before week 3, all or none effects. After week 8, growth and function affected. Example of drugs. ACE inhibitors, your pill drugs. Effects on fetus, renal damage. Alcohol. Leading cause of birth defects and mental retardation, fetal alcohol syndrome. Alkylating agents. Absence of digits, multiple anomalies. Aminoglycosides. Cranial nerve 8 toxicity. Vestibulocochlear. Look for issues with sensory, ear, auditory, balance, vertigo. Cocaine. Abnormal fetal development and fetal addiction. Placental abruption. Diethylstilbestrol, DES. Vaginal clear cell adenocarcinoma. Folate antagonists. Look for neural tube defects, spina bifida. Anencephaly. Iodide. Lack or excess. Look for populations as to where they're located, whether or not they have proper nourishment. Congenital goiter or hypothyroidism. Lithium. Patient mother who might be bipolar, taking lithium as treatment. Epstein's anomaly. Atrialized right ventricle. Maternal diabetes. Caudal regression syndrome. Enoatresia 2 cyrinomylia. Smoking. Nicotine, carbon monoxide, common compounds in smoke. Preterm labor, placental problems, intrauterine growth retardation, ADHD. Tetracycline. Discolored teeth affecting cartilage. Thalidomide. Limb defects, flipper limbs. Valproate. Drug used for seizures. Inhibition of intestinal folate absorption, therefore resulting in various folate. Vitamin A. Excess. Extremely high risk for spontaneous abortions and birth defects, such as cleft palate, cardiac abnormalities. Warfarin. Bone deformities, fetal hemorrhage, abortion. X-rays, anticonvulsants, multiple anomalies. Fetal infections of certain antibiotics can also cause congenital malformations. Please refer to the microbiology chapter of FirstAid. Our discussion continues with fetal alcohol syndrome. Leading cause of congenital malformation in the U.S., newborns of mothers who consumed significant amounts of alcohol during pregnancy have an increased incidence of congenital abnormalities, including pre- and postnatal development retardation, microcephaly, holoprosencephaly, facial abnormalities, limb dislocation, heart and lung fistulas. Mechanism may include inhibition of cell migration. Now let's take a look at the process of twinning. Fetal development. You will notice a timeline of 3 to 8 days. Prior to 3 days, dichorionic, diamniotic placenta. After 3 days, monochorionic, diamniotic placenta. Amnion is formed approximately after 8 days. Monochorionic, monoamniotic placenta. Risk for conjoined twins. The first illustration below shows us monozygotic. 2 amniotic sacs, 1 placenta, 1 chorion. One zygote splits evenly to develop 2 amniotic sacs with a single common chorion and placenta. Conjoined twins have 1 chorion, 1 amniotic sac. Dizygotic, fraternal or monozygotic. 2 amniotic sacs, same as mono. 2 placentas here, however, different. 2 chorions, also different from monozygotic. Monozygotes that split early to develop 2 placentas, separated, fused, chorions, and amniotic sacs. So 2 placentas, 2 chorions, and 2 amniotic sacs. Dizygotes develop individual placentas, chorions, and amniotic sacs. Placental development. Primary site of nutrient and gas exchange between mother and fetus. The fetal component includes cytotrophoblast, the inner layer of the chorionic villi. Cyto makes cells. Syncytiotrophoblast, outer layer of chorionic villi, responsible for secreting HCG, human chorionic gonadotropin. Structure similar to LH. Please keep this in mind. Stimulates corpus luteum to secrete progesterone during first trimester. Now think about that for a second. HCG shares structure similarity with LH. You are familiar with early LH having its effect on corpus luteum to secrete progesterone. At some point, the fetal component, HCG, coming from your syncytiotrophoblast, responsible for progesterone secretion. All occurs during first trimester. The maternal component, decidua basalis, derived from the endometrium, maternal blood in lacunae. Let's take a look at the illustration below. On the left is the overview of the placenta. What we're doing is taking a section of it, amplifying. Notice the amnion. You'll notice the maternal blood. Fetal vein will actually contain oxygen, one of the few exceptions. And of course, in adult life, pulmonary vein would contain oxygen. Fetal artery contains deoxygenated blood, which is now returning back to the mother. Branch villus. Cytotrophoblast, where is that located? The inner, remember, cyto makes cells. Syncytiotrophoblast, the outer layer, responsible for HCG secretion. Maternal vein, maternal artery, and there's a decidua basalis, derived from endometrium. Umbilical cord. There are 2 umbilical arteries and 1 umbilical vein. The umbilical arteries return deoxygenated blood from the fetal internal iliac arteries to the placenta. The umbilical vein, the single, supplies oxygenated blood from the placenta to the fetus and then drains into inferior vena cava. In the margin, single umbilical artery is associated with congenital and chromosomal anomalies. Umbilical arteries and veins are derived from allantois. In the illustration, take a look at the 2 umbilical arteries that contain deoxygenated blood from the fetal internal iliac arteries to the placenta. You'll notice the solo umbilical vein supplies oxygenated blood from the placenta to the fetus, contained in Wharton's jelly, surrounded by amniotic epithelium. Urethral duct abnormalities. Third week, yolk sac forms allantois, which extends into urogenital sinus. Allantois becomes urachus, a duct between bladder and yolk sac. Failure of the urachus to obliterate results in, number 1, patent urachus, urine discharge from the umbilicus. Number 2, vesico-urachal diverticulum, outpouching of the bladder. Here, we'll continue with vitelline duct abnormalities. During the 7th week, obliteration of vitelline duct, known as omphalomesenteric duct, which connects yolk sac to midgut lumen. On this slide, we'll see vitelline fistula, failure of duct to close, meconium discharge from umbilicus. Earlier, with patent urachus, we had urine discharge from the umbilicus. In vitelline fistula, there is meconium discharge. Meckel's diverticulum. Rule of 2s applies here. Approximately 2 years of age. 2 feet from ileocecal valve. 2% of population. Partial closure with patent portion attached to ileum. May have ectopic gastric mucosa. leading to melena and periumbilical pain. This now concludes our first part of embryology brought to you by FirstAid and Falcon. If you require further information, please refer to Falcon Online.